Today on the Perception in Action podcast, how important is feel or body awareness in sports? How can we assess kinesthetic sensitivity and proprioceptive acuity in athletes? And can these be improved through training? So it's time for a call to action. Hi everyone, this is Rob Gray from Arizona State University and PerceptionAction.com. Welcome to the Perception in Action podcast, where I discuss how psychological research can be applied to improving performance, accelerating skill acquisition, and designing technologies. In today's episode, I want to look at the topic of body awareness and its relationship to performance in sport and skill acquisition. What I'm referring to here is our ability to detect the position of our limbs and joints and how they're moving, without using our vision or any kind of external feedback from a coach or through a video. Try it. Without looking, can you say what angle your left elbow is currently bent at? Personally, I think this can be critically important for athletic success, particularly when trying to make small technical modifications or whole-scale technique changes in sports. As I've mentioned on the podcast a few times now, my big sport growing up was ice hockey, which I learned to play primarily from messing around on backyard ice rinks. I was a goaltender and did very well most of my career until I started to get to higher levels. At lower levels, all that matters was that I could stop the puck. But as I advanced, other details of my play became more important, especially in tryouts. How well positioned was I to stop a puck being shot around the boards? How well could I pass the puck to my defenseman? How good was I at deadening shots when I saved them to prevent rebounds? When I found I needed to improve in these areas, I was lucky enough to have access to some great coaches, including a former NHL goalie, who gave me a lot of small tips about how to position my body. When you make a save, make sure your hips are like this. When you want to shoot the puck around the boards, dip your shoulders like so. While I know now as a sports scientist that these heavily, internally body-focused instructions may not be the best way to go, I really tried to follow them at the time. But I quickly realized I completely lacked the body awareness to implement these technique changes. Keep your hips at a 45-degree angle. The only thing I could tell you about the position of my hips was that they were somewhere south of my stomach. Looking back, I often lament that I never participated in gymnastics or even figure skating to improve this ability, although I have to admit I would have hated it at the time. Another reason I think body awareness is important to think about now is because of all the wearables, trackers, analytics, etc. used in sports, which can give an athlete detailed information about their body position. I worry that this proliferation of external feedback might make the next generation of athletes even less tuned into their own intrinsic bodily feedback than I was, if that's even possible. So after that long preamble, let's dig into the topic of body awareness in sports.
Bastard from the start, but a charming one at that. Bad reputation, but it really ain't that bad. It's alright, I can't feel a thing.
Being aware of one's own body position and movement relies on two so-called internal senses, proprioception and kinesthesis. Now, most people seem to lump these two together, but what I was taught is that proprioception is the ability to detect the static position of our body. For example, the angle your knee joint is bent while you sit, or whether your head is tilted to the left or the right now. Kinesthesis, on the other hand, is a dynamic sense, in that it refers to your ability to sense the movement of your body. Was my wrist rotating when I threw the ball? How quickly was my knee angle changing when I was landing on the ground? That kind of thing. These two senses are actually specialized variations of our sense of touch, and they involve some of the same receptors as touch. Proprioception and kinesthesis rely primarily on two types of receptors: the Golgi organs in our tendons, which send signals to the brain related to the amount of muscle tension, and fibers within our muscles called spindles, which send signals related to the change in length of our muscles. How do we assess a person's ability to use these senses? Most of the studies I'm going to talk about today are focused on what is called quote-unquote proprioceptive acuity, defined as the ability to sense joint positions, movement and force of muscle contraction, and to discriminate movements of limb segments individually and relative to each other. So they're really talking about both proprioception and kinesthesis as I've defined them. There are literally dozens of ways to measure proprioceptive acuity, and we'll see almost every study I'm going to talk about today seem to use a different method. 3 of the most common ones, though, are reproducing joint angles, the absolute judgment task, and detecting passive motion. In the joint angle reproduction task, the person is blindfolded and their limb is passively moved through a set of angles they are told they will have to reproduce later. So, I might bend your arm so that your elbow joint is at 20 degrees, 30 degrees, and then 40 degrees. The limb is then moved back to a neutral position and the patient is asked to reproduce one of these angles. The difference between the target angle and the actual angle is taken as the measure of acuity. The absolute judgment task is again similar in that the target angles are demonstrated to the participant, but in this case they are assigned a number. So in my example, 20 degrees might be assigned 1, 30 degrees 2, 40 degrees 3. On each trial, their limb is then positioned at one of the target angles, usually by some kind of mechanical device, and the participant has to say what number they are at. Finally, for the passive movement task, the participant is again blindfolded and their limb is moved very slowly, usually again by some mechanical device. Their task is to indicate the moment at which they detect movement of their limb. In general, these methods have shown that an average person has very good proprioceptive acuity. For example, for the knee joint, acuity values can range from about 2 to 6 degrees, depending on the direction of movement. That means, for example, we can reproduce a 30-degree angle of our knee with only a few degrees of error. Okay, now that we know how to measure it, let's look at how proprioceptive acuity relates to sports. The first question we might ask is, does proprioceptive acuity vary with skill level? Following on the expertise approach used with other abilities, if higher level athletes generally have better proprioceptive acuity, then we can assume it's somehow important to sporting success. In 2009, Maudi and colleagues compared the proprioceptive acuity for knee rotation with 18 Olympic-level soccer players and 18 non-athletes. Proprioceptive acuity was measured using the absolute judgment method. Movements of the knee were internal and external rotations. Acuity scores were expressed using a measure called the just noticeable difference, which is essentially an estimate of the smallest difference in angle a person can reliably detect. What was found? Proprioceptive acuity was significantly better for the soccer players, ranging from about 1 to 1.4 degrees depending on the direction of rotation and leg used. For the non-athletes, acuity ranged from 1.5 to 2.4 degrees. Perhaps not surprisingly, this effect had a lot to do with the difference in performance for the dominant and non-dominant legs. For the soccer players, there was no significant difference in the acuity for these, while for the non-athletes, acuity was interestingly significantly better for the non-dominant leg. In 2015, Han and colleagues conducted a more comprehensive study, looking at 100 elite athletes, all competing at regional, national, or international level in China, across 5 sports: gymnastics, swimming, sports dancing, badminton, and soccer. There was also a control group of 20 non-athletes. The absolute judgment method was again used, and proprioceptive acuity was measured at 5 body sites: the ankle, the knee, the spine, shoulder, and fingers. What was found? For all 5 body sites and for all sports, acuity was significantly higher for the athletes than the non-athletes. Within the athletes, level of competition was significantly correlated with acuity scores for the ankle and the shoulder, but not for any of the other body locations. Using this data, the authors constructed a multiple regression model to try and predict sport competition level based only on acuity scores. They found they could explain 30% of the variance in level based on proprioceptive ability, which is pretty impressive. Finally, there was no significant relationship between the number of years of sport-specific training and proprioceptive acuity, suggesting that this may be an innate ability or one that we acquire early and that does not improve with training. This led the authors of the study to conclude that proprioceptive tests could play an important role in talent identification. But I'll return to the issue of improving proprioceptive acuity through training in a few moments. Okay, it seems like there's some relationship between proprioceptive acuity and sports performance, in terms of athlete-non-athlete differences, and even differences within competition levels. Another question we might ask is, how does it relate to skill acquisition? This question was recently addressed in a 2016 study by Kaiser and colleagues. This study involved participants learning a locomotor task. Specifically, they had to walk on a treadmill so that their foot height during the swing phase of the step matched the height of a virtual object shown on the screen in front of them. Before learning this task, 28 participants were assessed for proprioceptive acuity using a robotic exoskeleton. This device was used to perform the joint reproduction task and the passive movement tasks I mentioned a few moments ago. What was found? For the joint angle reproduction task, there was a significant correlation between acuity and the amount participants improved from pre to post training. That is, participants with higher acuity improved more. However, there was no significant correlation with the rate of skill acquisition. Performance on the passive movement detection task was not significantly related to learning the locomotor task in any way.
This kind of feeling would always descend on somebody else, and now it's got me too. I don't know what to do.
Okay, so far we've looked at how proprioceptive acuity relates to sports performance and learning. Given that athletes seem to be pretty sensitive to the positions of their limbs, how effectively can they actually use this information? Specifically, how well can they actually implement technical changes related to body position? This interesting question was addressed in a 2015 study by Giblin and colleagues. This study examined the ability of 8 internationally ranked junior male tennis players to implement very specific changes to their serve technique. Body position during serves was tracked using a Viacom motion tracking system. Technical changes focused on 2 key aspects of the serve: the maximum knee flexion and the impact position at the ball racket contact point. For both of these variables, players were asked to try and implement 6 different changes, which were the combination of 3 different magnitudes and 2 different directions. So, for example, for knee bend, in one condition they were instructed, quote, using the serve you just performed as a reference, increase your maximum knee flexion in both knees by 5% in the following 3 serves, end quote. In terms of magnitudes, they were asked to implement 2.5, 5, and 10% changes, and in separate conditions, they were asked to either increase or decrease the knee flexion angle. To help with this, they were also shown an image of a knee bend. For impact position, they were instructed to move this either to the left or to the right of their last serve, and with 3 different distances, 2.5, 5, or 10 centimeters. For each of these, they were also asked to rate how confident they were they had successfully implemented the change. Performance in these tasks was quantified by calculating the percentage error. So, for example, if you asked me to change my impact position by 10 centimeters, and I only made a 5 centimeter change, that would be an error of 50%. Finally, and importantly, the authors also compared these percentage errors to the variability of knee angle and impact position that occurred when participants were just executing their normal serves. What was found? Overall, while participants did seem to have some control over their movements, only some of the technical changes could be implemented with an accuracy that was greater than the inherent variability in the movement. But let's look at the results in more detail. For changes in knee flexion, players did produce systematic changes in the angle, but percentage errors significantly increased as a bigger change was required. 5 out of the 8 participants had variability in their knee angle that was greater than the smallest change, 2.5%. Thus, it seems any instructions that involve a change less than 5% are likely not to be successful. I think this highlights the difference between clinical measures of proprioceptive acuity and the messier world of real sports. Although people could easily detect a 2.5% change in knee angle, which corresponds to an angle of about 2.2 degrees, Making such a change to a dynamic action like a tennis serve is a different story. There was no significant relationship between errors and the player's ranking. For impact position, although again players seemed to be able to alter this, 3 of the participants had variability within their serve action that was greater than the largest change required. For the remaining 5 participants, variability was greater than 5 centimeters but less than 10, suggesting that only the instruction requiring the largest 10 centimeter shift in impact position might be able to be controlled by the participants. Interestingly, the participant with the lowest inherent variability was the best at implementing the instructions, but the reverse was not true. The highest variability participants were not the worst. In general, for both tasks, the level of confidence went up as the magnitude of change required was larger. Overall, I think this is a really interesting study that raises quite a conundrum for coaches. Given the results, very precise instructions, for example, change in movement by less than 5%, are likely to be very difficult for an athlete and get swallowed up by their own inherent variability. However, when asked to make a larger change, participants are significantly more error-prone, yet increasingly confident they can do it. Okay, we've seen now a few different ways how proprioceptive ability seems to be related to successful sports performance. Can it be improved through training? And will it make us better on the field? In a 2015 study, Ceylan and Sagan split 42 PE students into 2 groups. One that completed an 8-week exercise program, and one that completed an 8-week exercise program that also included balancing and jumping exercises targeted at improving kinesthetic sensitivity. For example, landing with your knee bent at a certain angle or holding your body in a given position. They then compared these groups with pre- and post-training measures of 3 dependent variables. Coincidence anticipation timing, which is basically a type of interception catching task, simple reaction time, and the Minnesota Dexterity Test of hand-eye coordination. Before getting to the results, I commend the authors on using an appropriate control group. As I discussed back in episode 18C, we know that exercise alone improves perceptual and cognitive functions, so that needs to be ruled out as an explanation for any training benefits here. What was found? The group that did both exercise and kinesthetic training improved significantly from pre to post test on all 3 measures, while the exercise-only control group improved only for reaction time and hand-eye coordination. Strangely, no statistical tests were done to actually compare the 2 groups directly. So maybe this study provides some evidence that kinesthetic training can improve abilities relevant to sport, but it's kind of weak evidence. In 2012, Danishu and colleagues examined 2 soccer warm-up programs designed to improve kinesthetic and proprioceptive ability, the 11 Plus and the Harmony. These both include a range of different balance, muscle activation, and strength exercises. I will leave you to check out the details if you're interested. Link in the show notes. 36 young professional soccer players were split into 2 groups that trained with either one of these methods. The joint angle identification test was used to measure proprioceptive acuity in the knee. What was found? The acuity error of the dominant leg significantly decreased from pre to post training by 2.8% for the 11 Plus group and by 3% in the Harmony group. So it seems like proprioceptive ability can be improved, but of course we're missing the connection to actual performance on the field in this study. Sticking with the topic of proprioceptive training, there is one particular situation in sports where this is very important: recovery from injury. Trauma to ligaments in the knees, elbow, etc. can very commonly lead to a damage in the connection between the kinesthetic and proprioceptive receptors I talked about at the start of this episode and our brain, resulting in proprioceptive deficits. This is a serious problem because, for example, not being able to sense the position of one's knee very well dramatically increases the chance of re-injury. Luckily, however, studies have shown that there is at least partial restoration of these senses that occurs after surgical reconstruction, and this can further be improved through proprioceptive rehab exercises, including using a wobble board, plyometric exercises, and training on some of the proprioceptive acuity tests I've been talking about through the episode. And it has been shown that proprioceptive training reduces the risk of knee injuries and ankle sprains. The final study I want to mention today was an interesting undergraduate research program conducted by Larson & Larson in 2016. Using 56 undergraduate students and a golf putting task, they sought to examine whether body awareness relates to choking under pressure. Given that one of the main explanations for choking is being overly focused on one's own movements, they hypothesized that those with greater body awareness might choke more. Awareness was quantified using a tactile 2-point sensitivity test, which involves poking someone with a pair of tweezers, one end after the other, and having them tell you which of the arm of the tweezer hit first. Using this data, a low and high awareness median split was created. The pressure test involved having people putt while being filmed and looking in a mirror. What was found? Surprisingly, the results were exactly opposite to the prediction. Those with the lower body awareness had a larger decrease in the number of putts made under pressure. However, although this is an interesting idea, the results are actually really hard to interpret due to a massive pretest difference between the groups. Okay, that's it for today's episode. I think body awareness is an interesting topic, and although it's too late to save my hockey career, I hope to see more work looking at how we can improve it and how it relates to sports performance in the future. Coming soon on the Perception in Action podcast, a series of episodes on the use of virtual environments for sports training. What are the potential advantages and disadvantages? What evidence is there for transfer of training to real sports? Remember, you can contact me at robgray@asu.edu or on Twitter @ShakyWeights. And to find out more about the podcast, please check out perceptionaction.com. This is Rob Gray from ASU. Cheers for now.
I've drunk myself sick.